Welcome to Premier Unbelievable, the show that brings together Christians and non-Christians for honest and respectful conversations. I'm Vince Vitale, and today we're asking, can therapy heal the soul? We'll be exploring mental health, including some complex and often misunderstood conditions, such as borderline personality disorder and narcissistic personality disorder. And we'll be engaging with both Christian and secular perspectives. So what happens when psychiatry meets theology, and how do categories like meaning, identity, and belief shape the path to healing? Joining me today are two leading psychiatrists who are also colleagues and friends, but who bring different worldviews to the same clinical work. Please note that this episode may include discussion of suicide, self-harm, and psychological distress. Please take care as you listen, and be especially mindful if you're tuning in with younger listeners. Now let me introduce you to these two outstanding guests. Dr. Claire Brickell specializes in the treatment of severe personality disorders. She works at the Gunderson Residence in Cambridge, Massachusetts, part of McLean Hospital, and she's deeply interested in how psychiatric treatment touches on questions of good and evil, who deserves happiness, and how people build meaning in a chaotic world. My other guest, Dr. Brandon Unruh, is medical director at the Gunderson Residence and an instructor in psychiatry at Harvard Medical School. He is a co-developer of mentalization-based treatment for pathological narcissism, co-editor of Borderline Personality Disorder, a case-based approach, and co-author of mentalization-based treatment for pathological narcissism, a practical guide. His work integrates literature, philosophy, and theology with clinical practice, and he has a particular passion for exploring the spiritual dimensions of healing. These are not only two leading thinkers, but also two extremely thoughtful practitioners. I personally have just very much been looking forward to this show. So let's begin. Claire, thank you so much for joining us. And I wonder if you could get us started by telling us just generally about the kind of work that you do and the kind of patients and challenges that you and Brandon see on a daily basis.
Thank you. Thank you very much for having us. This is exciting. And I was able to watch and listen to other episodes in preparation, and we're in highly esteemed company. So it's
wonderful.
It's a real pleasure. And always a pleasure to get to spend some time talking with Brandon. And we are colleagues in a very close-knit team in a residential program called the Gunderson Residence, which was started, when was it started?
2009.
I don't know, relatively new, for the residential treatment of borderline personality disorder and increasingly narcissistic personality disorder. And I know that when I was in medical school, I was really disappointed by how boring medicine was, how algorithmic medicine was. And one of the things that really drew me personally to psychiatry is how human it is. Like everything you do to the patient, you have to do with the patient. And we were saying in your introduction, can therapy heal the soul? And I mean, I guess technically believe in the existence of the soul, but that which we approximate as the soul cannot be separated from the work of therapy, in my opinion. And one of the things that's really central to both of these personality disorders is that people have a fractured sense of identity. They don't know who they are. I remember one of my very first patients, I gave some genius suggestion. She was feeling terrible. And I said something incredibly sophisticated, like, do something fun. And she just gave me this blank look like, how do you know when you like something? And I've realized in the years since then that is a terribly important question for our patients. How do you know when you like something as opposed to when you're supposed to like something, or people think you should like something, or you think it's cool to like something or moral to like something? That this sense of I, or me, is self, that I think healthy people really take for granted is missing or fragile in our patients. And
Wow.
a lot of the symptoms that bring people to treatment, such as suicidality, self harm, substance use, eating disorders, chaotic relationships, all of these things are to one degree or another a product of not having a stable anchor to the self. So you find yourself desperately seeking either love and connection or desperately seeking esteem and respect in order to find a brief moment of respite. But these patients are incredibly dependent on the outside world and on responses from other people to make them feel okay, in large part because they're missing that sense of themselves.
Wow. That is such a deep question about what is it that we actually like. I'm just thinking about this myself, as opposed to what other people say that I should like or other people think that I like. I mean, you really have my mind spinning even as you ask that question. And I was thinking the sort of work that you do, Claire, and you, Brandon. It's probably very intimidating for most people. Like the idea of setting a trajectory to do that sort of work would probably seem inconceivable to a lot of people. And I love what you said, Claire, about like medicine needed to be human. So I wanted to push a little bit further just into the motivation and some of the story about how you guys wound up doing this sort of work in the first place. So maybe I'll throw it to you, Brandon, to share a little bit about that, but then back to you, Claire, and jump in. We'd love to hear more of how you wound up doing this sort of work as well.
I think, well, first of all, thank you again, Vince. I've been a long time listener and viewer of this show. So it is a bit of a pipe dream come true, or some kind of, maybe I would have said in the past, an over idealized fantasy to being on the show. But it turns out maybe there is room for some ideals, believing in some ideals, because here we are. We can debate that a bit more, maybe. But I think Claire and I actually really overlap here quite a bit in our enjoyment of the pursuit of the deepest questions. I mean, maybe that sounds a little cheesy or grandiose, but I was thinking in preparing a bit for the show about how, for me, I think that goes all the way back, actually, to as far back as I can remember reading stories as a child that really presented some a notion of good and evil and right and wrong.
The Trojan horse that is Narnia.
I didn't even say Narnia, but I was going to say Middle Earth, Claire.
Oh, okay.
Yeah, right. We can talk about that. But this sense, this portrait that actually, yes, including in Narnia, there are these characters that actually are not actually so much inventing their own meaning as discovering some meaningful arc that's sort of actually beyond them or outside of them. And yet it's also deeply imminent. It's also there in a way in their experiences. It's being offered up to them to sort of align with or not in some personalized way. And so, maybe this is a little post hoc rationalization, but I think that prepared me to actually then come to kind of experience the Christian story as a meaningful narrative home for myself. And then as I got to college, of course, there was this tension between doubt and faith, and that very much still remains for me. But the courses I took in college that got me interested in becoming a psychiatrist, and specifically in being a psychotherapist, were courses that just dealt with all these deep questions. And so, I'll just mention briefly, I briefly, there it is. I'm not so brief when I say I'll be brief, but I do want to mention I took this one course offered by the late Armin Nicolai on comparing the worldviews of C.S. Lewis and Sigmund Freud. So there's my one Lewis drop. And I took a bunch from this course, actually. It educated me about some of the good reasons for why there is a historical clash between religion or spiritual worldview on one side and psychiatry and psychology, as opposing, so to speak, on the other side. It got me acquainted with some really important arguments that I hadn't contended with before, such as the notion that, religion is basically, it's the God, it's the hole-shaped God rather than God, rather than the hole in our hearts, being a clue to the real God that is. It's the God of our infantile wishes, as Freud argued. And the other thing I took from this course was the notion that neither of these two men that we were studying came to their position through purely rational means. So I got really interested in how we come to issues of worldview and how we make the deepest decisions about who and what to love and what to pursue in life. That I came to the view that actually these are not purely rational questions. These are existential, embodied, relational, narrative decisions that we make, actually. So those are just questions I never wanted to stop engaging with. And so, as Claire beautifully described, we've both found ourselves in this professional home of treating problems and working with people who are wrestling intimately and with the pain of being a person. And that's not to minimize what's unique about borderline and narcissistic personality disorders, but it is to say that actually the acute particular problems that they present with to our practices, I would say, are completely on a dimension with the pain of being a person, with what is universal human experience. And I think that's the hook for me, and why it's been so fun to have this now 15-year friendship with Claire, actually
Oh, wow.
debating these issues as we try to work them out in the trenches with our patients as well.
My trajectory towards becoming a psychiatrist was much less planful, actually. I think I became a doctor because I panicked at the end of college and I was like, the runway's ending. Like, what can I sign up for that's going to give me a lot more school? And then in medical
I can
school,
relate to that.
yeah. I couldn't conceive of myself outside of studentdom. And then during medical school, I always knew I was interested in, in the brain and thinking um, but I thought I wanted to be a neurologist until I did some advanced neurology rotations. And I found that the patients that interested me most were the ones who clearly had psychiatric disorders, but didn't want to admit it. And were there for neuro. I mean, the joke is that the definition between a neurologic condition and a psychiatric condition is that we know the cause for neurology. Like, as soon as you find the cause, it becomes a brain disorder. Before then, it's like just psych. Um,
Yes.
but I really resonate with what you're saying, Brendan, about narrative, like loving stories, um, and being part of the story of the person that you're working with, and getting a glimpse into their world. I also realized I learned so many random things about tiny niche. I got a patient who's a rare coin dealer. And like the paranoia and cutthroat competition of the rare coin dealing world is something I would never have known about otherwise. Um, all the glimpses into the very specific stories of people.
Oh, that's
So I
fantastic.
resonate with that. I want to pick up on something that you were saying, Brandon, that this idea of wrestling with being a person is hard for everyone, but especially people with BPD and NPD. And I think that a core symptom of both of these disorders that I feel compelled to mention as like a public service announcement as well, because this doesn't make it to the listicles of how to tell that everyone's a narcissist. Um, but that narcissism and borderline personality disorder are both characterized by this fundamental belief that you are toxic and evil and worthless, almost like you're like the TV show The Americans, like you're a deep cover spy and you have this cover story as a normal human or as an acceptable part of society, but actually what you're hiding is this loathsome, disgusting, um, potentially contagious self. Um, and everything has to be done to make sure that people don't see that.
Wow.
And that's why the question of good and evil becomes so central to our work, because so many of our patients come in convinced that they are evil. Capital E, even capital A, I am evil in a
Hmm.
very general, very unimmutable, unchangeable way. And sometimes our patients have, ooh, I just replaced parent with patient. That's an interesting Freudian slip. Anyway,
Analyze
um,
yourself.
no, but sometimes our patients have behaved in ways which are really disruptive. But sometimes they haven't even, and it's not a rational, logical calculus of I am bad. It's a feeling. I am bad and I am dangerous and I need to be sequestered from other people. I can't let people close because I'm going to hurt them or they're going to hurt me. And so recovery from that has to address, what is evil, and deserves who deserves treatment, who deserves to get better, who deserves to be part of the part of the tribe.
And the corollary, who and what is good, alongside what evil, who is evil or not evil. And so maybe this is a good place to sort of say that, for me, as you describe it so poignantly and accurately, Claire, when I'm sitting with someone who views themselves this way, this is where those earliest intuitions that I think came to me through those stories spring forth, and internally. And there's interesting debates about, well, how much of yourself and what you really think about the world and your person in front of you do you actually say or show to the person? Claire and I probably do that in some similar ways and maybe in some different ways. But my intuitions then, in the face of that kind of self-hatred, are that, actually the person in front of me is beautiful inherently, is beloved, actually. Whether or not I can muster up loving feelings in the moment, because sometimes they may actually be treating me quite aggressively or devaluingly. It's not like I'm always this perfect, paragon of loving feelings toward the person in front of me. But at the end of the day, I've got this sort of intuition and belief that actually this person is lovable by me because they are beloved by God. And that's not by their own merits, and it doesn't come through my own striving to muster up loving feelings, but because there's this relational love at the heart of the universe that actually desperately wants our good and is in the good and evil with us, actually. And here it starts to sound more like a story than a syllogism or argument or proof. But that is where my intuitions actually lie internally. And I suspect here we have, at some level, maybe some shared intuitions about what we want to resist about self-hatred in the person, but actually a probably really different sense of the grounding for those intuitions.
Mm-hmm. Yeah, and this is so
Exactly,
good.
because
And
sorry, Vince, go.
no, that's okay. Yeah, you could feel free to continue, but I just wanted to throw in, this is so helpful, and I wonder if you guys also could just make it really concrete for us, who are not in the context that you're in, sort of day to day. So as you continue discussing this, maybe would each of you have an example of a situation where, like, your worldview maybe had an influence or an impact on either a clinical decision or an insight that you had in this context?
Yeah, and well, I'll say, and it is picking up on what Brandon was saying, because I absolutely agree. A really important part of my worldview, which does not include the existence of God, and in my opinion, I think the idea of God is unnecessary to understand the world or to be a good person or to. I mean, I'm not like I can't prove God doesn't exist. I'm not against the idea of an existence of God. I should also say I'm Jewish and I'm a member of a synagogue, and I had my bar mitzvah and my kids will too, and that's really important to me. It just has nothing to do with God, in my opinion, um, or little to do with God. Um, but I believe very strongly that love is a feeling, an emotion, not a calculus, and that either all humans are worthy of dignity and respect and love and care, or none of us are, which Brandon has told me is a very Christian idea. Um, and I mean, can't be wrong about everything. Um, I don't know whether to me, I guess it doesn't come from God. It's a decision that I have made about how I want to live my life. And I am, I think more than you are, Brendan. I'm very explicit about my worldview with patients. And I say very frequently, like, I don't believe in good people and bad people. I don't believe that people are defined by one thing they've done or one thing that they haven't done. And I also believe very strongly that people can change. In fact, the whole point of what we're doing is to help people change. And if people can't change, if people can't grow, if something like being evil is a stain on you or a curse put on you that you can't avoid no matter what you do, then our work is all entirely pointless. And I think of it much more as you've been behaving in a way that you don't like or don't understand or don't want to follow, and that doesn't serve you, doesn't make you happy, doesn't help you function, and you want to do differently. Um, so, and I talk about that really explicitly with patients, who sometimes push back, and, or, sometimes see differently or have different worldviews, but I want them to know where I'm coming from in it.
Great. So interested, Brandon, to hear where you resonate and have points of commonality or divergence here, and then in a few minutes we'll take a break.
Great. So, this is a good place to put in a caveat. It's interesting, Claire, you say, yeah, you do actually share explicitly. And I think I've heard about that from some of our shared patients. Oh, yeah, I know Claire's an atheist. I guess part of my hesitation about doing that is that I don't want anyone to worry, and I think this is a justified worry that the world has about religious people, for lack of a better phrase, that there will be proselytizing, there will be abuse of power relations, and the psychotherapeutic relationship is an inherent power differential. Our patients are expected to do the work of being completely vulnerable, and that means completely self-disclosing, and we, by contrast, are not completely self-disclosing and not in the vulnerable position, coming to them in the way they're coming to us. So, given that, I wouldn't want anyone to worry hearing this, if there's any past or present or future patients out there, that in coming to me for treatment, that you should worry that I'm out to convert you, to my own perspective. The caveat to the caveat is, of course, that the very nature of having a worldview, I think, means that one generally thinks it is true and tends to hope that others might come to share in that view. Maybe Claire will disagree, as I do when I'm privately, willing and praying often for my patients to come to know the Christian God. But it's never my intention within my professional role to do anything that reeks of proselytizing, because my patients are not coming to me for a sermon. I actually think that would be unethical for me to try to use that platform and influence within that power differential to persuade them about my spiritual beliefs. So, but the other thing I say, and I think this goes to Claire's point, that her patients come to know this about her. It's all in the room, I like to say sometimes, when patients ask me for my personal position about some question of meaning. And that sounds a little cryptic, but it's meant to allow room over time for patients who are interested to get to know things about me to actually get to know over time, as some of them do, that I have a deeply embedded Christian framework. I think that's not any more true of me than for any other clinician. I think just as Claire's patients would learn that she's an atheist, and kind of reckon with that part of who she is, some of my patients over time have learned in various channels that I'm working from a Christian worldview inside. And shameless plug, I wrote about one such example in that book on treatment for narcissism. So I don't explicitly bring it into my sessions, but it does permeate my therapeutic self, just as the same probably is true for Claire's worldview.
I think that Brandon and I both are shamelessly trying to convert our patients to the idea that, as you said, Brandon, I think that they are beloved, that they're precious, that they're worthy of love and respect. But that doesn't come from having to check certain numbers of boxes. People will love me if I graduate from an Ivy League school. People will love me if I'm really nice all the time. People will love, they have these artificial and unattainable ideals of what it would mean to be worthy of love. And absolutely part of the treatment is helping them see that, love's it's a feeling. It's not a calculus. And my patients sometimes repeat that back to me, and they're sort of like, yes, I know, love is a feeling, not a calculus. I'm like, yeah, you're listening, you know? And I think just an important difference is, for me, what does God have to do with it? I don't think there's a God involved. I think there's the person in the room who loves them, and that's me, you know? I've been very angry with my patients and very disappointed with my patients. But fundamentally, if I don't love them, then something is really, really wrong.
Okay.
And you guys may remember better than I do all the 7 different kinds of love that the Greeks had, like philios and eros, and is it
Agape.
storge? Is that the love for someone that you're taking care of, that you're responsible for? Um, and yeah, I just don't think we need to invoke God to help somebody see that they're beloved and that they're important and that they can be. And especially, one of the, it's okay to get technical into object relations for a second. Another way to characterize borderline personality disorder and narcissistic personality disorder is a really heavy reliance on splitting defenses. And ego defenses are ways of understanding the world, understanding the self, keeping a whole-ish sense of self. And what splitting is there's this split that gets created between the good and the bad. And on one side of it, I'm a good me connected by good feelings to another good person. And if any of those 3 conditions aren't met, then I feel bad, I have bad emotions, and the other person is bad too. And it's a defense mechanism, because what it defends is the potential existence of the ideal. And people with NPD and BPD get caught up in this never-ending search for an ideal relationship, an ideal job, an ideal body image, an ideal career, whatever. That there is a place, a home base that they could find where they are perfectly beloved by a perfect other. And one of the sticking points for me about religion is that all of our therapy is designed, I mean, not all of our therapy, but a huge thrust of the therapy is to help people accept and live with the fact that that ideal doesn't exist. And that our world does not include perfect people connected with perfect feelings to perfect others. It's an ideal that people have to mourn and grieve, and accept the much messier and much more imperfect reality of the world as it is. But then it's like, well, but except for God, who's perfect and loves you perfectly, and in whose eyes you are perfect. And to my mind, that just sort of like, it's a real mixed message. I don't know.
That is such an interesting way to put it. It's Claire's asked, why is God necessary here? There's a feeling, it's love. You can have that feeling. Yes, you are beloved, but I'm in the room and I love you. And that was really interesting, Claire, too, what you said about actually the very therapeutic treatments. Are they kind of inherently designed on the assumption that there's not this ideal of a perfect lover that's loving you perfectly? So, Brandon, how do you think about these things?
Well, this is, so this is where I think there's a really important and meaningful distinction to be made between the insistence on finding these idealized caregivers, or ideals in general, on the insistence on finding them, crafting them, forcing them to be there within ourselves and within other people, versus actually believing in ideals in what I would say is the proper place for ideals, which, is in art and philosophy, literature, and religion. that we should separate actually the insistence on looking to human relationships to measure up to some perfect over idealized standard. That is where so much of our patients and my own, frankly, suffering comes from. And similarly, when we try to actually kind of contort ourselves upward into some idealized notion of what I'm supposed to be like as a person, these are clear sources of suffering and psychopathology and just existential pain. Um, but I think there's a meaningful distinction to be made here that Claire may not agree with. But maybe I'd share an example here. And I think Claire's heard me discuss this patient a bit in the past, but this is somewhat disguised. But this makes me think about this woman who was in her mid-20s who came to our program many years ago with both borderline personality disorder and bipolar disorder, and had this recurrent series of suicide attempts. And each of these had happened after some profound interpersonal disappointment. And what was getting disappointed or thwarted in her story was that she felt like she'd become too much for the other person. These were friends, romantic partners, and she had been looking for the perfect caregiver in these relationships, and became profoundly anxious, angry, and ultimately self-harming and despairing and alone when these relationships predictably would not measure up to what she was looking for. That's a very classic story of borderline personality disorder. And so as part of the treatment, week after week, I'm sitting with her and we've kind of identified, look, the goal here is to reduce your dependency on other people, get away from these idealized expectations of yourself and others. Let's practice tolerating reality and imperfect human relationships. I think Claire and I would agree completely about that. But then one day, as we're kind of working through all this, and she had been doing actually better. She was functioning more out in the world, was working. She had the trappings of a life at this point, but that inner pain that came from this frustrated search for an ideal attachment actually that was unabated, really. And she came in one day to a session and was just sobbing, and I didn't know why, so it took a moment for both of us to compose ourselves a little bit, and she eventually told me the story. She said she'd been at work that day, and on a smoke break, she went outside and was just standing there kind of aimlessly smoking, and then across the street, there was this man and this little girl standing next to this man who seemed to kind of lock gaze with her and actually approached her across the street and just came up to her and said, "God loves you." And then again, "God loves you." And these were perfect strangers. And then again, "God loves you unconditionally, no matter who you are, where you've been, or what you've done," something like that. So they're sort of offering up this
Not creepy at all.
Right. Were these like traveling evangelists? Who knows? But she's crying as she's telling me about this. And she says, "Brandon, I started to cry and I haven't been able to stop since then. I don't know why. I don't believe in this stuff. I don't believe in this stuff. I don't believe in this religious, spiritual stuff, but I can't stop crying. Could it really be true? What is happening to me?" And it was this, Claire and I will interpret this moment, I think, in very different ways. It'd be interesting to get your take on it, Claire, but I didn't know what to say. I mean, I did the typical therapist-y, shrinky thing of you sort of like just rolling with it and asking, well, what's it like to imagine that kind of love might really be out there for you? And you could do that kind of therapeutic, response, whether, regardless of what you believe about it. You're just exploring the person's experience in the moment, hopefully to get to something that's more meaningful to them about this possibility. But for me, internally, part of what's happening in a moment like that is among the other possibilities I'm entertaining. And some of those would be like, oh, this is her borderline personality disorder. Again, overly projecting idealized, longings onto other people. It could be that. It could be her bipolar disorder. Maybe she's a little bit loose in associations. It could just be because of her borderline personality disorder. Anyone who kind of throws her a bone, so to speak, and does anything nice would be like hyper meaningful when she's struggling. But then there's this other possibility that for me, I'm really entertaining in a moment like that. Maybe this is the relational love at the heart of the universe that actually is imminent to her in some way. that's actually kind of presenting itself. It's actually breaking in. And there's a moment here where she's actually got a chance to either align with it, pursue it, explore it further, or move away from it. And I was very interested in what she'd make of all that.
Was she able to sustain a sense of connection
Well, this
to
was,
being loved?
yeah, it didn't go on, much further than that in that case, actually. For various reasons, the treatment ended not too long after that, actually, but for reasons I won't go into. But your question suggests something important to recognize here is that for people with personality disorders, religion and faith is not a panacea to these problems. There is I hear just as often from our patients about problematic relationships they have experienced with religious figures, religious systems, religious ideals. And oftentimes what's helpful is to actually help somebody move away from that. It's not always a moving toward, a particular religious ideal or community. So there is an inherent instability about relating, I think, to this notion of an ideal, and that would include the ideal of God. I think we see that, in general.
Claire, I'm interested, like in that sort of situation, do you think, given the fact that you and Brandon have different worldviews, like would your approach to that situation be different? I mean, could there even be a concern about encouraging someone to maybe entertain that possibility that sort of love could be possible and out there?
I was thinking about that as Brandon was telling the story, and I made the joke about it being creepy. And I do think that if somebody had come to me while I was trying to have a break and started talking to me about God loving me, I'd have been like, yeah, like I don't want to hear about that right now. Um, it would feel invasive. It would feel invasive. Um, but I don't think I would have handled it very much differently at all with the patient
Mm,
because it fits very well with my worldview that people like to imagine God, and if imagining God is helpful to them, then great. The way people also imagine, I don't know, like my mom would be so proud of me if she, my mom who died when I was a child would really love it that I'm, I don't know, working in this field or that I'm happy or I can feel her presence sometimes. Um, I think that this idea of God is kind of a metaphor for this longed for ideal. Um, and I think that some people, and Brandon, you are like a really incredible example of this, who managed to take the part of religion that is love and connection and follow on that, as opposed to the part of religion that is like, the rules are you should not be gay, or you should not wear this thing, or you should not turn lights on Shabbat. Like because that is the danger with our patients, because they're so vulnerable to being rule bound. Coming back again to this idea of the really fragile sense of self is that it's very attractive when there's something external that
mm,
defines wrong from right.
yes.
And if there's a list of rules that they can follow and convince themselves, like, oh, I'm doing everything right, that can be really organizing, but also really limiting because they're not developing for themselves.
Mm,
And my sense of you, Brendan, as a person is that you have managed to both have like personal investment in developing your sense of yourself and who you are and who you want to be, with the capital M meaning and capital R rules that come from your
mhm.
religious faith.
Can I
But
also ask guys
I
about the relationship between truth and treatment? This kind of came in at a couple of points. I was just think, I mean, whatever the example is, but if somebody was engaging in astrology, just take hypothetical
uh-huh,
example, and maybe
uh-huh.
you're both convinced, that astrology is really false, but it seems to be at least temporarily stabilizing them in some way. How do you think about the relationship between whether something is true or false, and whether or not to encourage it, or how to approach it in the context of therapeutic treatment?
I actually have a patient right now who's super into astrology. who, yeah, who several. It's not as uncommon as you might think. Um,
Absolutely.
and the way that I approach it is kind of like what you were alluding to, is that it is useful to make certain types of decisions, but not others. Um, and in the sense that, like, when I was trying to decide where to go to college, somebody gave me the advice that I should flip a coin. And I was like, that's not a smart way to decide where you're going to go to school. And this is a friend of my mom's. She's like, you don't actually have to do it, you know? It's just that when the coin's in the air, you notice what you're hoping for.
Interesting.
So it was a sort of projection of a way to get in touch with what you want. And I think astrology, Christianity, Judaism, whatever, etc., if it's a tool that the person is using, not a tool, but um, if it's helping them build and discover a sense of themselves, then I think it's really good for them therapeutic. If it's coming in as this rote substitute for a sense of self, then I think it's really harmful. Whether or not it's true.
Yes.
That makes sense. So.
I think that's a really nice distinction, the way you just laid that out, Claire, between what might be called, it's kind of a heavy word, but sort of pathological religiosity and a healthy religiosity, making no truth claims about any particular, worldview there. But, there's good empirical research actually linking certain expressions and forms of spirituality and religiosity with human flourishing, psychological well-being, virtuous character development, these kind of things that we think are generally psychological goods, and other forms that actually seem to be negatively associated with those same phenomena that we all seem to want at some level. So I really like the distinction you made there. I suppose where I go one step further, or maybe further forward or further back, depending on how you see it, being a Christian is, and I'm listening to the person who's has an astrological worldview, as actually the patient I talked about did as well at the time anyway, when she had this experience. And I'm listening with, again, sort of my own ideas about the meaning structure of the world in the background. They're bracketed in my mind. They're not usually explicitly in my language to a patient. But I am remembering that I believe in this God who's the author of all that is good, all that is true, and all that is beautiful. So if there's something good and true and beautiful about this patient's interaction with astrology, not only actually might that be in this moment something that is a good for them if we assess it together and see that it's fostering a sense of self, but it also might, it's possible for me that actually the God I believe in, who's the author of all that good stuff, may be actually relating to this person, even in this other system or worldview. And so again, here's where my intuition or belief that this Christian God is deeply relational comes into my work, I think implicitly, because this is good news for the person with borderline personality disorder. I think it's good news for all of us, but especially for someone who's so desperate to be securely connected in relationship. This is the idea that actually the Christian God doesn't respond to our distress by answering questions about why bad things happen, but enters into the world alongside us, right? The belief is that Jesus the Son actually is one with God the Father and enters into suffering on the cross, suffers alongside us, and gives us a picture actually of what he's like and how we can be close to him. So I'm thinking of this Christ behind the scenes who says, I'm the vine, you are the branches, so abide in me, which basically means attach yourself to me. So I'm imagining the further possibility that actually there's a living God actually out there who's actually here with us, as creepy and mystical as that sounds. I'm aware it sounds creepy.
I don't think it does sound creepy. Especially not as you're saying it. I mean, because you're saying it. I mean, this is my stringy affect bias, right? But clearly, it's comforting and exciting. It's not creepy. My main objection is that I think it's just unnecessary. Like, I think all of these things can be true, that there's a sense of love between people and that we can find meaning in life and we can be good people. And I just don't think God adds anything
Well,
to the.
may I
I know you
may I come
disagree.
back on that a little bit? Because here we were at the heart
So,
of, I think, where you and I get animated and excited about talking about this, because this is where I wonder, one of the things for me about the Christian worldview is it does, for all of the problem of evil and all of the, I think, legitimate and difficult to answer objections to it. One of the things I think it does succeed at doing, at least psychologically for me, is actually provide some grounding in rational coherence for some of these intuitions, which I think you and I really share, such as the notion that the person in front of us who sees no worth in themselves, has tried to end their own life many times. Perhaps part of them at least would like us to agree with them in the moment that that's actually the true state of their soul, as it were. But actually, in what do we ground actually our therapeutic pushback against that? I don't mean that we just simply come forward and say, but actually, you're a good person, or but actually God loves you. I don't think either of us do
yeah, it's
that.
not going to work.
But
Yeah.
our pushback in our dedication to doing the work to help our patients, have greater degrees of freedom so that they might not choose to die by suicide. This requires, I think, these intuitions not just to be the byproducts of evolutionary psychological processes, which you and I agree are there and always operating, but I believe they require actually something further to be true at a transcendental level about the way the world is. It actually has to be the case, I think. It's not just that I love the person in front of me or I think they're lovable. What's the worth of my opinion at the end of the day? I actually think it has to be grounded in something beyond the psychologies of either of the two people sitting there. So I wonder how you would respond to that, Claire.
I mean, I think that you're getting in a different way at something that's really fundamental difference between how we think. Is that my sense is you believe that there is a foundational, God is behind it all, and that there is therefore like a truth and a way. And
A
I
true story about the world, let's say.
Yes, a true story about the world. And I don't think that there is inherent meaning or order or um, uh, narrative to the world. I mean, I think there are physical truths and the way things happen to go and things like that. But I think that as human beings, because we have these brains that do things and try and make sense of things, that we need to decide on a way of acting. It's like free will. We can't know whether we really have free will, but we have to act as if we do. Um, I think it's sort of like we can't really know what's virtuous or what's moral, what's good, but we have to act as if we do and make a decision that has integrity.
And
And yeah,
for you, what grounds the choice to act as if? I think you and I both feel that intimately that we must. But I struggle to see sometimes actually where the imperative is, or maybe it's just that we have different imperatives here. For me, part of the imperative again is that there's a relational God who, first of all, deals with me through this unconditionally loving relationship that's sort of on offer. And that's not a passive position I just accept and enter into. No, it's actually that in receiving God's love, I'm actually called into it. I'm called to partner in it. I'm called
mm.
to love the world in just the way that Christ loved the world and died for it. I'm called to lay down my life for my neighbor. So so that story kind of anchors
Mm.
I would say the oughtness. And elevates it beyond an intuition, beyond a psychological experience. It becomes a
So I'd say
psychological
an ought, like you ought to, like you
ought-ness.
should.
Yeah, yeah. I
Okay.
ought to actually align myself with this story about the world, because there is something actually that's independent of my psychology and independent of collective human psychological processes, which of course I agree are there as well. So
Mhm.
I struggle to see sometimes the imperative for going beyond this is what I feel towards my patient, which you and I would agree on, to this is how I ought to act. I ought to act as if.
There's actually so much overlap between you in how you approach your patients. Brandon was talking about where the imperative comes from for that. Where's the ought come from in terms of how you ought to treat your patients in these contexts? And I'll throw that back to you, Claire, for a response.
I thought briefly I was saved by the bell and I wouldn't have to answer because I don't know that I think there is an imperative. I don't think it's imperative. I think I choose it. And then of course the question is why? And the answer is something sophisticated, like it feels right. And I think it works.
Well,
Yeah.
can I push in on that a little
Uh-huh.
bit?
Yeah.
Because
Yeah.
let's go into the consulting room. So let's suggest that you or I are sitting there then with someone who insists that they are worthless and not worthy of belovedness, as both you and I would intuit
Mhm.
that they are. So you've got your sentiment at the moment, which leads you to make a choice. And I guess the question for me is, yeah, what's to sort of elevate your move in that direction, or to justify it in a way? I mean, it seems to me there has to be something more than just this particular psychiatrist who this patient happens to be sitting with happens to find them lovable, in order to kind of push against their own certainty that they're not. It seems to me that requires an expression of a truth claim about the way the world really is and who that patient really is.
I mean, it does require a truth claim about the world in the sense that I don't believe that being loved is something you need to earn in the same way that a lot of our patients think about it. But
Hmm.
I actually disagree that there has to be anything beyond that. I don't think it's enough for my patient that I happen to love them, right? Especially because my love is meant to be transitional, right? That they use that and use that relationship and then outgrow me and go on and live a life where they don't need me anymore, which is the tragedy of parenting and psychiatry. Um, but no, they're saying like I am unlovable and I am the embodiment of the counterfactual. I'm like, no, but if I'm sitting there trying to convince them that they shouldn't die and that they aren't worthless, it's because I believe them not to be. And I am just one person, but if you're really worthless, then you're worth nothing. And I'm sitting here saying like, no, but I love you. And
They're worth something to you, and that's
yes,
real in an important way. Yeah.
yes, yes,
Mhm.
exactly.
Yeah.
Um, and often for me, one of the first things that I point to with my patients when they don't see anything lovable in them
Yes.
is their willingness to work to try and change. And this is something really interesting because a lot of our patients are very narcissistic, which means that they're very success oriented, very um, worried about external markers, either of success, like income and education and things like that, or of morality, like never being angry or never hurting other people. And as a result, they view being in this intensive psychiatric program as really shameful. I'm embarrassed that I have to be here, that I need this
Hmm.
intensity of treatment. And you couldn't possibly admire me or love me because you're the doctor and you get to go home at the end of the day to your family. And I'm stuck here being a loser, being sick, having something wrong with me. And to me, I mean, I'm in the very, very lucky position of not having to do intensive psychological work in order to dig myself out of a pit of psychological despair. I don't know whether I would do, that's pure luck. And they are in that position and they're choosing to do something about it, even though it's really hard and really painful. And the outcome is uncertain. That's where there's absolutely has to be faith, right? Like, why am I going to put in all of this effort to look at myself and acknowledge my failings and acknowledge the way that I've hurt people and try and change it without any guarantee of success? And I find that just the willingness to engage in that really admirable and worth loving and appreciating, and no God involved.
I think I agree with all of that, and I just want to go a bit further with it to show where I think Christianity can come in and actually kind of adds more layers to what you're saying, Claire. It doesn't take away from anything you're saying, I think, because of course I really hopefully, I mean, I pray that I really share your humility and the sense of the power in, well, the sense of there but for the grace of God go I is how I would say it. You know, I think you and I both know it just could be us at any time on the other side of the couch, so to speak. But
why would God grace you and not them?
That's a deep question.
Because
I don't know.
Feel better about it being just luck. Because then then there isn't like an entity, a supposedly all-powerful and all-knowing and all-loving entity that is gracing some more than others.
That's where I think it gets a little dicey because, you know, from my perspective, I don't think I can say who God has graced more than anyone else, actually. And this goes to the problem of evil. And it's difficult to say sort of how much blessing or grace is there for one person at any one particular moment in their lives. What's God doing, you know, through suffering and tragedy? So that maybe is a whole other conversation. But I agree, it's not a question that's answered easily. I take the point. But just back on narcissism for a minute, if we can. I really think about the problem of pathological narcissism. It's like a two-sided trap, or it's a coin with two sides. On the one side, you have this problem of grandiosity, what's sometimes called the pathological grandiose self. And that's this sort of way of being, thinking about myself, feeling about myself, being out in the world. But it's an ideal that's getting propped up through self-enhancing behaviors or thoughts or feelings. But that's happening as a protection from the other side of the coin, the intolerable, vulnerable sense of toxicity, inadequacy, you know, being an incorrigible failure. And so going back to this issue of truth, well, is truth outside of psychological experiences, is that required to sort of push back and help somebody kind of remold this psychology? Well, one definition I like to use of truth is sort of admitting who we are in relation to who God is and who we are in God's eyes. So I would say on the Christian view, this notion of pathological grandiose self, it's pathological because it's a distortion not just about who we are, but who God is. So there's this verse in Isaiah that says, the grass withers, the flowers fall, but the word of our God endures forever. This notion that God's thoughts are higher than our thoughts. Another verse in Isaiah, you know, my thoughts are not your thoughts, neither are your ways my ways. And so this notion that there's a speech, there's a perspective on the person in front of me that's actually higher than my perspective, that's truer than my inherently oscillating human perspective. And that, I think, for somebody with narcissistic vulnerabilities, to hear that can either be heard as the like most dangerous pointed threat or the greatest comfort. Because it's a threat if I have myself on the throne of my own life. If I have to be, and I think we see this together about narcissism, Claire, if I must be my own master and the sole captain of my own ship, measuring up or falling short strictly on the basis of my own strivings, that's a threat to hear there's actually a rival out there, that I'm not actually on the throne of my own life. I can't control myself, but it's a comfort, it's a relief, and it might allow rest if I'm ready to get off the throne and let God's speech about me be the truth, as if that I'm going to act from. And that, I think, deals with the other side of the narcissistic coin, the problem of like pathological self-hatred, because that other coin is to say there's this special unforgivableness about me and my who I am or what I've done. But that also is kind of it's a trap, because it sort of fails to hear something about the words of the maker. If I have that profound self-hatred in front of me, one verse I often think of is another one from Isaiah. That's I think it's Isaiah 1, where God says, "Come now, let us settle the matter. Though your sins are like scarlet, they shall be white as snow." And I love that verse, because it's like God is going to argue with us, actually, and says, "Let us settle this. This is how you really are." And that's different if there's a God who's saying that to us and about us than me, Brandon Unruh, saying it to a patient, I would contend.
And let me just jump in there for 1 second, and then I'm going to absolutely throw that to you, Claire, to hear your response. But I thought that was so intriguing, earlier when you said, why would God give grace to Brandon and maybe not to others, and that's unfair. And it just, in my mind, it just had me thinking, there's a couple times where you said, I just don't think God adds anything, like he's just not necessary. But there was part of me that was wondering, could it be that God, if he were true, would add something, especially in some of these categories of faith and hope and love that you both really agree are necessary for the work that you do. But maybe there's a real challenge to coming to the place of saying that could be true. And could it have something to do with really the fact that that doesn't seem loving if Brandon gets that grace? And he can have this beautiful kind of picture of reality, but other people don't get it. And that actually seems quite unfair, and therefore doesn't seem like how a loving God would proceed towards all of us. I don't want to. So that's just a thought. You can let me know if I'm totally off base there, or how you would reflect on that.
Yeah, I mean, I think the like, if I forget who I'm quoting, but the like, if God is great, he is not good. If God is good, he is not great. Like, can be both omnipotent and good at the same time, because the world is not fair. I actually had I threatened for years, and then I did have a T-shirt made that said, didn't say life, I had a curse word instead, but life ain't fair, that I wore to work because it just isn't. And I I actually don't, like, I hear what you're saying, right? That there's this, if you believe in God, you believe that there's this higher authority who has judged us to be good, who loves us, sort of
Yes.
no matter what we do or say or think or how we feel about ourselves. And maybe, I don't think there's a way to disprove or prove it, but I keep coming back to the fact that we still have to learn to live in human society and to connect to other people in ways that are subjective and human and have human consequences, right? Because I was talking to a patient the other day who's like, I just keep feeling like if I'm very skinny and really beautiful and very good at everything, and everything comes easy to me, everyone will like me. And that's just not true. Like, that's not the person that people like. Those are not like, those are enviable qualities, but that's not the same thing as liking you, you know?
Right.
And I'm trying to get my patients away from this idea that there is a single objective ideal, that there is a right way to be, as opposed to a right way for me, or a right way for my family, or like a functional way. Or patients who say things like, it's better to be a doctor than to be a circus clown, which is a nonsensical statement, right? That better, apples and oranges, it
Right.
doesn't, or it's better to be funny than smart, or things like that. They make these statements all the time about things that are better than other, where it's actually a subjective difference of opinion, right? And one of the huge therapeutic tasks is being able to accept different perspectives without putting them into a hierarchy. Like, more, so you're right, or you're smarter, so you're right, or you're taller, so you're right, whatever. and actually, like, we disagree, but nobody's wrong. And I think that religion goes against that, because it says, like, this is the truth. This is the right way. And I think that can be, I mean, like everything, it can be useful, but it can also be dangerous, especially for our patients. And I think that's part of why it doesn't work for me personally. I don't believe that there is a right answer or right way. There are just many. Like that, essentially, the world is meaningless and without plan.
I would say only in brief response that we each are, I think, kind of making a claim here, an equally forceful claim about the way something is or is not. I don't think I'm in a special position arguing for a more matter-of-fact way I'm saying the world is. I think I hear you making just the kind of opposite claim that actually, no, Brandon,
Yeah.
actually, no, Brandon, this other stuff is kind of like, it's evolutionary epiphenomena. It doesn't, we don't have to layer that in. I think you're making an equal and opposite claim about the way the world is. And that's where I would say you and I are both, I think, resting on faith. And so if we were to agree that we're both operating in a faith dimension, landing in opposite claims about the way the world is, then, well, there's certainly an argument for embracing faith as an explicit part of recovery, which I think you and I both do.
Absolutely.
And there's good research to back this up, actually. I would just throw out all the research linking flourishing with flourishing in borderline personality disorder specifically. There are studies showing that recovering from borderline personality disorder tends to be associated, for most people, maybe not all, with some strengthening of some meaning-making system. And I'm deliberately using the most kind of inclusive language there because we know it's not religiosity for everyone. But the studies do show patients who've had borderline personality disorder who now identify as fully recovered, when you ask them what ingredients were important in your recovery from suicidal, self-harming behaviors, emotional overwhelm, unstable relationships, they tend to say something of a spiritual bent. They tend to actually, there's some recent work on this actually by Sophie Liliadol that actually cites experiences of transcendental experiences in nature, or with animals out in the wild, or with little children. And you and I would debate, Claire, whether those are inherently spiritual experiences or not. But even there, for me, the God who loves the little children, the Jesus who...
Or whether it's the recovery from borderline personality disorder that allows people to get out of their own head enough to connect with nature and children, and right, they're no longer spiraling in the morass of despair.
Yes.
Do you guys think about recovery differently in light of your worldviews? Even kind of the title we were talking about, healing, healing for the soul. Do your worldviews play into almost the, thinking about the desired outcome or the end destination? Are you at times taking slightly different routes to the same ultimate hope and goal, or does it actually impact the way you think about what you're hoping for your patients?
I mean, every time you have to ask a question like slightly or at times, the answer is always yes. Like, we're not going to be perfectly aligned, but I think that I mean, this research that you just cited brings to mind something that I think we both emphasize, that recovery means also capacity for joy and transcendence and play and imagination and humor. It's always a really good sign when a patient who previously was never, ever, ever making jokes makes jokes or was never, ever able to fantasize. Like, I mean, in the psychiatric sense, is that word has become really linked connotatively with sex, but I just mean like imagine, want, think theoretically about things. And that does all fall under a category that I guess is broadly described as spiritual.
Yeah.
But again, I don't think involves God.
Well, pragmatically, I think I would argue that yes, a concept of a spiritual orienting system is useful without making truth claims about which is which. But that seems to be an important ingredient. Again, whether that's an orientation towards nature in a transcendental way or towards a meaningful social role. Often, our patients discover a sense of meaning by actually serving other people. And again, that doesn't have to be explicitly connected to the God who comes down to serve us ultimately by serving up his life. For me to stand firm on making that claim with my patient, recovery is not going to be just about your self-harm symptoms going down, but actually about you entering this world Claire describes so poignantly of creativity, vitality, intimacy, service to others, gratitude, forgiveness, humility. I mean, fun. Thank you for letting me not leave that one out. I have to say, as an aside, working with Claire Brickell, I have to put this in somewhere, is devilishly fun, I will say. Wildly entertaining, as I hope everybody's getting a taste of. It's such a joy.
I don't have a problem with joke telling. That's not a...
Excellent.
Thank you, Brandon.
Guys, before we finish, I would really love for each of you to be able to speak directly to our audience, because many people will be listening. We've covered a lot of ground, but who resonate deeply with some of the feelings of meaninglessness or hopelessness or confusion that we've been discussing. And so maybe I'll throw it to you first, Claire, but to those who are watching and maybe feeling these things or in relationship with people who are struggling with some of these things, what would you want to say?
Yeah, I think a lot of our patients and a lot of people in general have what I think is a really tragic aversion to asking for help. Believe that asking for help is the nail in the coffin of being normal. And if people could come out of this hearing my really deep admiration for being able to ask for help, for being able to say to yourself, to your loved ones, my life is not working. I need to do something differently. And to do the very brave work of change instead of trying to white knuckle it through or, muddle along. But I do really believe that everyone is worthwhile in one way or another and can find a way to, or at least could try to find a way to feel that worthiness.
Yes.
So.
Well said.
Well, I would say first to my dear friend Claire, I love that we share essentially, as I can see, the same intuitions about the value of our patients. And I think this sort of simultaneous tragic sense of life and goodness in life. And I see her following that in her work, and it's so admirable in my view for those reasons. I think that if you, Claire, were to attend to the true sort of wideness and depth of these intuitions, that's where I think there's just something a bit extra for me. So just to speak to that, to the audience, I think, yeah, Claire said it best, but to anyone listening who identifies with some of these issues we've discussed around borderline and narcissistic difficulties, I first want to say, yes, there's help, there's treatment. Turns out we're filming this in Borderline Personality Disorder Awareness Month. So there you have it, plug for getting help and trying to do the hard work, which I think both Claire and I deeply admire in all of our patients. But I would just add, that if you were to come to my office, this is not a call for referrals, but for anyone who's meeting me in
let's put Brandon's phone number, just
address,
nice.
phone number.
Yeah.
But for anyone kind of coming to my professional space, what I would want to be doing, and I hope that we're all doing at some level, is holding on to this deepest possible hope for you. And that's a hope not merely in yourself or who you can be or who you are, or my skill set or your clinician's skill set, or how great a therapist or not they are. But I would want us to hold to the hope that essentially is about what I believe Jesus did for you and for me on the cross, which just changes everything for me as a person and also as a therapist. And I won't be telling you that you need to know that Jesus in our clinical role. And I won't be saying all your problems will be solved if you do come to know him, because that's not true. Jesus said himself, in this world you will have trouble, but take heart, I have overcome the world. So in this more open frame of interaction than I usually am clinically, I do invite those listening to consider this story, that Jesus may be the ultimate answer to those narcissistic and borderline parts of all of our hearts. At least that's the story that resonates most deeply with me.
Brandon Unruh, Claire Brickell, thank you both so much for such a rich, real, needed conversation, not only for the work that you do, but for the way that you live out the core values at the very heart of it. I'm deeply grateful for you both. Listeners, I hope this has been an encouragement to you as well, and I hope you'll explore more by checking out our archive of podcasts, videos, and articles at premierunbelievable.com. Follow us on social at Premier Unbelievable on YouTube, Instagram, and Facebook. Unbelievable FE on X. And if you're enjoying the podcast, hit follow, leave a review so more people can discover conversations like this one. For now, I'm Vince Vitale, and this has been Premier Unbelievable. Thanks for listening, and see you next time.